Today is World Cancer Day, a celebration which aims to prevent billions of deaths each year by raising awareness and education about cancer and pressing governments and individuals across the world to take action against the disease. World Cancer Day 2022 marks the first year of a new 3-year campaign centered on the issue of equity with the theme Close the Care Gap. This year's awareness draws attention to the lack of equity in cancer care. According to the WHO, cancer ranks as a leading cause of death and an important barrier to increasing life expectancy in every nation. A 2019 study found cancer to be the first or second leading cause of death before the age of 70 years in 112 out of 183 countries. In 2020, there were about 19.3 million new cases and 10 million cancer deaths worldwide. Nigeria is currently estimated to have 233,911 cancer cases, with 124,815 new cases and 78,899 cancer deaths yearly. Executive Director Project Pink, Runcie Chidebe, joins me now for more on the World Cancer Day. Good to have you join us.
Thank you very much. I really honored to be here.
So I know you get to work with cancer patients from time to time, and this year's theme is quite spectacular in that it is focusing on the prevention and treatment of cancer and the barriers towards being able to have access to treatment. And we know that issues like this, low income is always one of them. Issues of people with disabilities is another. Talk to us about this and some of the experiences you have had or you have seen in this regard.
Okay, yeah, thank you very, very much. Yeah, you see, the World Cancer Day provides us globally an opportunity to really review a lot of issues and a lot of gaps that are in cancer care. For instance, as we talk today, there are many regions of the world that don't have access to radiotherapy. Radiotherapy is a cancer treatment. So sometimes you could see a lot of people travel from one region to the other just to have this kind of treatment. Across the Africa, right, there are over 20 countries all over Africa that don't even have one single radiotherapy machine. In Nigeria, as we speak today, only about 11 to 12 facilities actually have a radiotherapy machine. So it's so difficult because patients have to travel from very distant region to another region to be able to access care. A clear example is that in the whole of south of Nigeria, for instance, there is no single public-owned radiotherapy machine that is working, right? The only facility that is working right now is just the Asuko, a private facility in Calabar. So it means that if a patient is actually diagnosed with cancer that needs radiotherapy treatment, let's say, for instance, in Bayelsa, he or she will have to travel far away, like Abuja, to get this treatment. And sometimes some people who have cancer may probably have other disabilities and other issues and comorbidities that come with it. Another pathetic thing, again, the patients are really passing through as a gap is also funding. Cancer is really expensive, and not many patients can really afford this treatment. So in most cases, people will have to sell their property. People will have to, borrow money and do a lot of other things that they ordinarily wouldn't do. I mean, I have a patient who told me that the son had to drop out of university to ensure that she gets help. So the gaps are huge, especially patient-centered. But we hope that the World Cancer Day will be an opportunity to call on stakeholders to close these gaps.
And these kind of issues should be discussed just beyond the World Cancer Day. These are issues that people live with every single day. And the story you just told of a mother whose child had to drop out of school is quite sad. And that's the story of a lot of people who are living with this disease. You were mentioning radiotherapy earlier. I was reading a report earlier in the day, and I found out that it is just one radiotherapy machine that is in the north region, another region of the country. And as a country, we only have 90 cancer specialists, which means that, for over 200,000 patients, only 90 specialists are available. You have to wait your turn, and in waiting, people lose their lives. So how do we close these gaps in the country?
Yeah, thank you very much. So you see, healthcare workers for cancer, which is oncologists, is such an important issue, especially when you talk about cancer. Because cancer is not like other form of disease whereby you have cancer, you just see one doctor and you get the care that you need and you're fine, right? Cancer is a sort of, group of diseases that when you get cancer, you're expected to see a surgeon, to see a pathologist, to see a clinical oncologist, to even see a pain doctor in the case of palliative care. So it needs multidisciplinary team to be able to treat this patient. Unfortunately, we don't have a lot of this multidisciplinary team in many parts of the country. Where we also have them, a lot of them are actually leaving the country to other countries of the world, like Europe and America and all the rest. So this becomes a very serious issue, right? So 90 or less than 90 oncologists are treating, hundreds and hundreds of patients. This is unacceptable. This is a huge gap that needs to be closed. And based on the question you asked on how can we close this gap, I think, the President of the Federal Republic of Nigeria, President Muhammadu Buhari, have made a very strong commitment in 2016 when the National Assembly passed a bill. The name of the bill is known as the National Institute on Cancer Research and Treatment. When this bill was passed in 2016, in 2017, December, the President signed this bill. It means it becomes a law. Unfortunately, from 2017, December 22 date, this bill has not been gazetted, neither has it been implemented. And this bill is so important. I mean, having this institute is so important because with the institute, you could be able to have an agency, just the same way you have the National Agency for the Control of AIDS. You could also have the National Institute for Cancer Research and Treatment. And this institute can help to galvanize action, to galvanize, to monitor prevention, to organize national screening so that people can present cancer early, to organize and direct research so that we can even know if the medications and the chemotherapy we're giving to patients, is it really working or not? So because right now what we have in the country is that we have less than 20 people who are at the Ministry of Health in the National Cancer Control Program, managing a disease that is killing over 100,000 Nigerians. So this is a very huge gap that if we have this institute implemented, it could help even in terms of funding, in terms of even bringing donor agencies to help provide support for people who are battling with cancer across the country.
Again, we're calling on the federal government to come into this in terms of closing the gap. But we also know that, when it comes to issues in the country, cancer is just one of the issues that within the health sector alone that the federal government has to deal with. There are other issues within the education sector, and it's just the federal government. So I want to ask you, what should the state governments be doing at the moment, and then how do private individuals also come in?
Thank you very, very much. This is such an important question you've just asked. Yeah, I mean, to be very, very honest, I think this is the right time for the state government and the state governors to take intentional action on cancer, right? Because many of the states across the country don't even have a cancer control plan. Neither do they even have cancer in their ministry's budget or ministry's plan. Just a very few states are making a lot of effort in cancer, and I can name them. For instance, Lagos, for instance, like Kebbi, Niger State, Ondo, and Rivers State has just committed to building a facility, and Kano State is building a Muhammadu Buhari Comprehensive Cancer Center, in Kano, and a few other facilities, a few other states across the country. But others are practically doing nothing. It is so painful because most of the state governors actually assume that cancer is not a priority and they focus more on infectious disease. But the painful thing I tell you today is that most people survive the infectious diseases and they eventually now die of cancer. So this is really pathetic, and I think the state government and private sectors need to also invest in cancer. I mean, in Nigeria, we've heard of a very big philanthropist who is trying to build a powerful cancer center in Kwara State. This is commendable, and I think donors, private sector, corporate organization, this is a call to you all to really fill this gap, because I mean, this disease is taking every one of us every single day. It's taking our uncles, our brothers, and it's more pathetic that it's taking people away at the time that we needed them most, at the age that they are beginning to be more important to this country.
Absolutely. Thank you so much. Cancer knows no age boundaries. It has no class boundary, education boundaries. It's a disease that everyone has to focus on and find a way out of. Thank you so much for talking to us. Executive Director, Project Pink, Runcie Chidebe. Thank you so much.
Thank you so much for having me.